I'm pleased to report that we continue to see signs of slowing transmission in Alberta. Over the past week, our average positivity rate is 25.7%. That's lower than most of the past month and signals that we may be plateauing. Wastewater signals remain high at many sites, including Calgary, but some areas are seeing a decline or plateau over the past week. That includes Edmonton, Red Deer, Canmore, Banff, and Grand Prairie. Edmonton has seen high levels recently, but the level has dropped sharply in the past week. Now, it's too soon to know if it's a start of a sustained downward trend, but the signs are hopeful. And the surrounding communities in the capital region are seeing a much slower increase than in the initial Omicron wave. As is always the case, even if transmission is slowing as it appears to be, hospital admissions will continue to rise for a few weeks. Hospitalizations have risen by about 8% over the last week, while the number of people in intensive care has remained about the same. Overall hospital admissions are up slightly, but are still in line with pre-COVID years. We're now about 5 weeks in the BA2-driven surge in transmission, and we can see that the impact is much less than the initial Omicron wave, especially when it comes to hospital admissions. Other provinces are experiencing a similar trend. In Ontario, for example, it appears that BA2 circulation has plateaued and begun to drop, with a much lower overall impact on admissions compared to the BA1 wave. This is a testament to the power of vaccines, so I want to thank every Albertan who has been vaccinated and boosted against COVID.
Sadly, between April 19th and April 25th, an average of 9 deaths per day related to COVID-19 were reported to Alberta Health. By comparison, U.S. data estimates that prior to COVID, there was an average of 1 death per day per 2 million people for influenza and RSV combined, which would work out to about 2 to 3 deaths per day in Alberta on average. Clearly, COVID is still something we need to be very mindful of. We will, as a population, continue to be exposed to COVID virus. It will likely be more prevalent in the fall and winter months when we typically see respiratory viruses circulate more, just like influenza has for many, many years. What we don't know, of course, is the impact that viral evolution will have and how new variants of concern might interact with our population. So there remain unknowns about COVID. But ultimately, what we have seen, especially with the past couple of waves, is that, again, vaccines are incredibly effective at minimizing severe outcomes, and that as we go forward, we'll need to continue to monitor the evidence about not only the effectiveness of our current vaccines, but whether there are new products that might be able to help us with additional protection, and whether there's new therapeutics that can also help people with early treatment. So there will continue to be changes and updates to evidence as we go along. But the bottom line is that I think all of us will need to think about, if we're in a time where COVID transmission is high, what are our risks and how do we protect ourselves? And then if we're in a time where COVID transmission is low, that may be the time where those who have risk factors are able to do more without adding those layers of protection. So we need to be able to, flex our response based on what our current environment is.